Democrats want to extend coverage to millions of people, low-income people in some red states for Medicaid expansion. There is a lot standing in the way of that plan. It's expensive, it's complicated, there may be legal challenges. At the same time, there are more than 2 million Americans in this Medicaid coverage gap. 60% are people of color. Our conversation today is about equity and affordability. Can Democrats expand, say, Medicare to cover additional benefits like dental and vision, while also balancing this goal of expanding coverage through Medicaid and closing the Medicaid gap? What is the higher priority?
Well, I think it's really clear that we cannot continue to make policy choices that would leave Americans behind. And right now, we know that some states have remained chronic holdouts in refusing to offer their lowest income residents an opportunity to have high quality comprehensive health care. Those are the same states that tend to have severe racial and ethnic disparities in health outcomes across, infectious diseases and chronic diseases, mortality rates, things like that. And so, I think it's very important that as we are here to lead, as we are here to bring transformative change, as we are here to build back better, we make good on our promise to those Americans who have been seeking an affordable healthcare option for now a decade, right? Like we're 10 years past the passage of the Affordable Care Act. Those Americans have been isolated, right? They have not had an affordable healthcare option, while so many of us have had options, whether it was Medicaid expansion or taking advantage of the marketplace. And so I'm really excited about this moment. I think that at least among House Democrats, we are very clear on the need to do this work. I think that Senate Democrats are very clear, particularly on the opportunity for a political argument to be made that the Democrats did deliver on their promise of Medicaid expansion. When you look at the Senate map, I think it's very important to their political prospects. And so I think that, on Medicaid expansion, we're going to be in very good shape.
Just to quickly underline this point, this conversation that you and I are having, Congresswoman, is about equity. And given that Medicaid is the program for low-income Americans, shouldn't expanding Medicaid be the priority when it comes to equity?
Well, certainly. I think we have an opportunity again to cover low income Americans who've been left behind. They tend, in these states, we see more health disparities, right? We see, for example, these southern states that tend to have worse health outcomes across metrics than other states across the country that make other investments in the health and well being of their residents. And so by taking this action and providing additional resources to cover these Americans, I think it's 12 states, we have an opportunity to make tremendous gains towards affordable, equitable healthcare. President Biden has said that in all of his policies, he wants to center equity. And that's what this Medicaid policy does. I do a lot of work in the maternal health space, and the postpartum Medicaid expansion is one of the areas that we are so excited about, the opportunity to make that policy permanent. That will allow us to save moms' lives, which has been our mission in the Black Maternal Health Caucus since we founded it in 2019. And so I'm really excited about this conversation that we're having. For those who are watching that are big champions of Medicare expansion, hearing, dental, vision, listen, nobody in our caucus is putting aside that as a priority. I want to make it very clear. We understand the severe barriers for folks to be able to get affordable dental coverage. I, as a nurse, understand the linkage between dental care and other physical health ailments, right? And we know that even persistent pain can be linked to, lack of dental care. I understand all of that. But when we're talking about the dollars that we have available to us with this limited pay for, right, allowing Medicare to negotiate drug prices, we're going to have an opportunity for the Medicare beneficiaries to see significant out-of-pocket savings. Significant. Right, by having their prescription drug costs lowered. And we have an opportunity to sort of share the wealth and cover more people by allowing the Medicaid coverage gap to be closed.